Hey family, thank you once again for tuning in to another episode of Living Your Life Without Limits, a show about motivation, inspiration, and elevation. I'm your girl, Shannon Jackson, also known as the People's Nurse, and today we'll be talking about PCOS. But before we go any further, make sure you click the like button and subscribe. Now I have a special guest joining me to talk about this discussion, none other than Dr. Amy Jones. Let's get right into it.
Wake up, everybody, let's elevate your mind. Live your life without limits, no more wasting time. Don't forget to stay focused while continuing.
Once again, family, I'm so glad to have you join us today. Now we're going to dive into this topic with none other than Dr. Amy Jones, who is a gynecology specialist, which focuses on women's health. Dr. Amy Jones, it is a pleasure to have you on Living Your Life Without Limits. I want you to know I am a huge fan of yours, and I am so excited to have you on the show today. Thank you so much for joining us.
That's my pleasure. The feeling's mutual. I'm so excited to be here.
Excellent. So this topic, just for full disclosure, it's very near and dear to me because my daughter actually asked that we introduce this topic to talk about it because she herself has some personal struggles in the area of PCOS. So for our viewers and listening audience, can you first give the definition of what PCOS is?
Sure. It's hard to define. It's a little unclear, and it's a multifactorial cause, but PCOS stands for Polycystic Ovarian Syndrome, which is a bit of a misnomer. It does not mean that you have cysts on your ovaries necessarily. A lot of people make that mistake and they're afraid that their ovaries are full of cysts, which is not necessarily true. That refers to the appearance of the ovaries on ultrasound.
Okay.
People with PCOS have a lot of follicles. Follicles are the little sacs of fluid that contain the eggs. And so on the ultrasound, these all kind of collect toward the rim of the ovaries, hence giving it a cyst-like appearance. But they aren't really cysts, so that's the first thing I wanted to get across.
Okay.
Polycystic Ovarian Syndrome is really a constellation of symptoms that kind of all come together to form this syndrome. So it includes oligomenorrhea, which means that your periods are infrequent. I think the technical definition of oligomenorrhea is less than 9 periods per year. So you just get infrequent periods. It's often associated with insulin resistance and dyslipidemia, so cholesterol issues, and often associated with obesity as well.
And the interesting thing about this particular condition, and now it's also recognized in the month of September as national awareness about this, it is often misdiagnosed. Why do you think that's so?
Yeah, I think it's because of the multifactorial nature of its etiology. I think because it presents in different ways. And so we tend to focus on each specific symptom, which is not necessarily a bad thing, but we tend to focus on each specific symptom and treat that and name that, but we fail to see kind of the bigger picture of the syndrome. So, you know, someone with obesity or insulin resistance who's tending toward diabetes would probably see a primary care provider who would treat those things, which needs to be treated. And then someone with irregular periods would see me and maybe take birth control pills or something to treat that. And so each individual symptom's being treated, but the big picture of PCOS is often missed.
Yeah, it's, you know, and more people are missing it and then having complications develop later on because of that misdiagnosis. So what are some of the core symptoms that women should look out for in case something is wrong? Like something's off, you know something's off, but you don't really know what it is, right? And you keep going and they keep saying, well, it's just this, it's just that, and it's...
Yeah. Well, what patients are often complaining about when I see them are their periods.
Okay.
Because I'm a gynecologist, so I'm not getting my period, I'll skip my period for 3 months in a row, and then I'll get a period that lasts, 6 weeks. I just don't stop bleeding for 6 weeks. And so that definitely is a sign of PCOS and something that you need to be seen for, needs to be treated. Other things are hirsutism, so hair growth where you don't want it, like on the face, nipples, sometimes elsewhere on the body where you don't want it, and sometimes hair loss where you do want it on your head.
Yeah.
Those are the main symptoms that patients complain about to me. Other things, though, typically obesity is really inevitably leads to PCOS. So that for sure is something that should be considered when a patient's being treated for or seen for obesity.
Also, type 2 diabetes is another secondary issue that's connected.
Yeah, absolutely. There is a strong connection between insulin resistance and PCOS. We don't exactly know why. It's kind of a chicken and the egg thing, what comes first. We know that that testosterone, so one of the things that characterizes PCOS is a hyperandrogenic state, so elevated testosterone in the bloodstream. And so testosterone and insulin resistance kind of have a synergistic relationship. The more of one, the more of the other. And then the periods, the irregular periods, are caused oftentimes by the excess adipose tissue in obese patients, which secretes estrogen. So the fat cells secrete estrogen, and then that feeds back to your brain, and then the axis from your brain to your hypothalamus to your ovaries gets messed up because your body thinks it has enough estrogen, and so therefore the signal to ovulate doesn't occur. And therefore, you get the disordered menstruation. And that's, not necessarily a bad thing immediately, but something that should be treated, because years and years of not getting your period means that the lining of your uterus is just kind of getting thicker and thicker and thicker and not shedding. And anytime any cell line in your body grows without, being regulated, without shedding, then it can lead to cancer. And so that's
which is one of the things that is a concern there.
Yeah.
So how is it diagnosed? So to let people know, okay, now I may have some particular symptoms that you just laid out. How does it get diagnosed?
There are 3 primary criteria we use, and there's different sets of criteria that have been presented, and people can use sort of different sets of criteria, but most gynecologists adhere to the Rotterdam. It's called the Rotterdam criteria. So 3 things: hyperandrogenism, oligomenorrhea, and then the appearance, as I was talking about, of polycystic ovaries. We call it the string of pearls on ultrasound. And a patient who has any 2 of those 3 symptoms is diagnosed with PCOS. So infrequent periods with high testosterone levels, infrequent periods with hirsutism or abnormal hair growth, or any 2 combinations. The ultrasound findings with the hirsutism would make the diagnosis.
What about treatment options? Once a person is diagnosed, and I'll have you talk a little bit more about that after we talk about treatment options. It has a huge psychological impact, not just the physical of the bleeding and not bleeding, and sometimes very painful down in the area, but psychologically, it messes up the psyche, and because it can have impacts on your relationship, on your sexual. Yeah,
absolutely. Any number of things. So, first of all, depression is more common in these patients. Yes. Eating disorders are more common in these patients. And so these are things that need to be screened for. But yeah, you're right. So you're concerned because you're not having a period, and rightly so. And then when you are having a period, you're bleeding a lot and you become anemic, and that's uncomfortable to, just be bleeding day after day. And so these all have psychological repercussions, especially when you're in the dark about what's actually happening. You don't know. You think something's wrong with you. Why is it happening? And you don't understand. And so that's why it's important to kind of be able to put all these pieces together and tell patients what's going on, and tell them it's not, it's very common. It's a very common diagnosis, and can be treated easily in a number of ways. So our first line of treatment for patients who are obese is weight loss. Even 10% weight loss will help restore just a normal
It's interesting how
cycle.
everything circles back to weight.
I know.
In some area or another. I don't care what you get to, whether it's cardiac, whether it's this, or whether it's that. Weight has an enormous impact on health altogether. It still does.
No, you're right. You're right. And I think people don't realize that quite enough, that it's not just that you're overweight and that's a lot of weight to carry on your joints. It affects all these things.
Yes.
So weight loss is but that's not easy,
Right.
It's not easy to do.
Especially with the pandemic.
Exactly.
Everybody was locked up for so long. People trying to shed the pandemic weight.
COVID-19.
So, yeah.
Then the next line is for me, birth control pills. So we just want to get the cycles regulated. Another very good alternative is an IUD, progesterone IUD, so a hormonal IUD. Because those work by keeping the lining of your uterus thin. And so while you still may not get a period when you have an IUD, at least the lining of your uterus is thin, and so we're not concerned about the endometrial hyperplasia or cancer. So some form of hormones. And then really just target treating the things that bother the patient. Of course, these patients are much more prone to things associated with metabolic syndrome. So like I was talking about the dyslipidemia, so they may need statins for their cholesterol, or definitely their hemoglobin A1C. So their potential for diabetes is very high. So that needs to be followed closely and treated.
What about
if
thyroid?
necessary.
I've heard some discussion that they sometimes look at the thyroid as well. Hypothyroidism can be associated with it as well. I don't think it's as strong an association as the insulin resistance say, but yeah, hypothyroidism for sure can be associated with it, particularly because it causes weight gain a lot of times. Now, one of the big ones that people wonder about with this condition is, can I have children?
Yeah.
That's, am I going to be sterile, or should I? Is last option if all else fails? We've tried A, B, C, and am I going to be able to have kids?
I get that question every time.
Okay.
And I totally understand it. And yes, absolutely, they can have kids. It's obviously a problem if you're not ovulating. You need to ovulate to get pregnant. But the good thing is, we were talking about those follicles in the ovaries. Those all have eggs, and they have a ton of them. So it's not a problem of not producing the eggs. We just need to get them released, and that's done pretty easily with medications.
Okay.
Nobody wants to take extra medications, but honestly, just Clomid or some sort of ovulation-inducing medication works great.
So you've had some cases where women have been successful to get pregnant and deliver, because you also OB specialist as well.
Yes.
So she can treat you on this side, and she can also treat you on that side, although this is her love now that she's going to be talking about over here.
Yeah.
So what are some of the recommendations that you would give? Because I want to segue into just women's health as a whole, because I want to talk about some other things that you're doing. So what are some of the recommendations or comforting words you can provide to women that may potentially have PCOS or struggling with PCOS? What are some of the
I think first of all,
nuggets you can give to us
Don't
today?
be too concerned. As I said, it's very common. We are used to seeing it so frequently and treating it so frequently. It is easily treated. And any of the problems that we talked about can be treated and fixed. I would say don't hesitate to come see your gynecologist, because we're all too familiar with the symptoms, and we can kind of, it's nice to be able to explain to someone what's going on and have them understand, because I think that takes away so much of the anxiety surrounding the sort of stigma, or I don't know if it's a stigma, but the scariness associated with the diagnosis. So come see us, come talk to us if you have any, questions about your cycle, or you think that this might be something that you are suffering from.
So in addition to doing all this wonderful work, taking care of women, I know you recently launched a new business with a partner. So what made you go into that, first of all, before you tell us about it?
You know, my partner Janet and I worked together at where I worked previous, and just being on call in the middle of the night and talking about patients and what they were wanting and needing and what we were feeling like we couldn't provide for them. And so it kind of evolved into recognizing that women were wanting some non-prescription, kind of more natural products to help with some of these problems that they have, problems that don't need, you know, prescription medication or surgery or, you know, the other things that we do.
What are some of your what are some of the hot selling items?
Okay, so hot selling items, Coco New is one of our biggest selling items, a coconut-based lubricant. People love that. Mm-hmm. We sell a lot, actually, of we sell a lot of probiotics. So there's vaginal insert probiotics and then oral probiotics that you can take, which, you know, some evidence shows is helpful to help prevent infections, yeast infections, bacterial infections. And then the boric acid suppositories, kind of in the same vein. Those are used to treat vaginal infections. Does a pretty good job. Actually, boric acid is pretty good at treating infections.
And you also have products specific for PCOS as well, correct?
Yep. There's a product that we just started carrying. It's by a company called Wink. It's called Soul Sister. Cyst with CYST.
I like the wink.
I know, it's cute. And it's a supplement that you take. It's called inositol. Is the main ingredient, which is a molecule that's in every plant, every animal. That has to do with kind of hormonal regulation, and so it helps to regulate periods, and it helps a lot with the insulin resistance component of PCOS.
Okay.
And it's a natural remedy as opposed to some of the prescription stuff that we would recommend.
Wonderful. I know more people are looking at natural ways and not just because sometimes from the nursing end, when I do a med reconciliation, whether in someone's home, on a private or in a hospital, the list is enormous. Sometimes it's 20 pills that they're taking. Literally, 20 pills a day is a lot of medication. So it's great when we can find more natural things, because sometimes all this doesn't work well
and I think
interacting
people
with each other.
Hesitant to tell their doctors about that because we're doctors and, you know, evidence-based. We're always going to recommend medication because that's what we do. But we recognize that that's not what everyone wants, and that's not what works with everyone's body, and they want to try alternatives. So these are safe alternatives.
Good. And you also have some intimate items for pleasure.
Yes.
So there's a variety.
A treasure trove of sex toys that are awesome, that people really like. Yeah, there's even cool little aphrodisiac candies that people tend to really like.
Okay, all right.
So some fun products as well.
So, family, the holidays is coming up, and 15% in this economy, 15% is 15%. So if you use the LYLWL code, you can get a wealth of healthy things to put in your body, on your body, as well as pleasure yourself, as well as your partner at the same time. So make sure you check out the site and give us some feedback and comments so that we can provide that information over to Dr. Amy Jones as well.
Yeah.
Dr. Jones, I want to thank you so much for your time and your expertise. And fans, I have to tell you, family, I love this woman so much. I had a issue a couple of years ago, and she was my doctor at that time, and since it's not, but that's going to change in the future. And I'm so grateful that she was the one that I had seen for care, because I knew someone that had a similar situation happen with a very, very different outcome. So not only is she talented and beautiful inside and out, she's very skilled with gifted hands. And she took her time with me and had a stellar team working alongside of her, and I came out just fine. And I've been a fan ever since.
I've been a fan of yours since day one, so I'm so glad you found me.
Yes, likewise. So once again, family, thank you for tuning in this week to another episode of Living Your Life Without Limits. This subject is sent out for the women, and please take this information and check in with yourselves and check in with your doctors, because that's part of loving yourself, is making sure that you continue to be healthy and be whole. I want you to sign on and give us some feedback on this subject. We're aiming to go deeper on living your life without limits and reach things that will help you have daily quality of life. And subjects like PCOS and other topics that we're bringing is for you and designed for you to continue to be healthy and live your life without limits. So please make sure you leave a comment and don't forget to click and like this episode today. And follow us on our Living Your Life Without Limits website, where we have so much fresh information. We have that free resource section, and we have our media section to let you know what we're doing. And we have our Street Love that we're in production for, doing some upcoming episodes. So lots of wealth of information. And once again, I'm so honored to have my esteemed guest, Dr. Amy Jones, be with us today. And as I do always, family, and getting ready to sign off today, remember to love yourself. Take care of yourself, because guess what? You are absolutely worth it. Thank you again. See you next week.